also, it is still a brand new year, so why not go for a younger you like Tessa is doing?
Yeah.
Right there in the video on your screen. From the latest in skin treatments to get rid of sun damage, even treatments to enhance your jawline, to effective weight loss solutions like semaglutide, we're going to show you some quick procedures to help turn back the signs of aging with our friends, of course, from the AntiAge Institute. You're going to want to stay tuned. Our friends from the AntiAge Institute are stopping by with answers to common questions about Botox, fillers, lasers, even weight loss drugs like semaglutide. That is when Houston Life returns. Do not go away.
Well, welcome back to Houston Life. You know, it's a new year, and if one of your goals for 2025 is to look and feel better, the team over at the AntiAge Institute of Houston says they can customize a solution for you.
Yeah, they've got the latest lasers to get rid of age spots and sun damage, Botox to get rid of lines and wrinkles. The list goes on, and we do have a whole crew here in studio, two of their licensed experts, Megan and Eller here, along with Haley and Matthew, two of their patients. We're going to learn about more of their treatments in just a moment, but first, Dr. Richard Laconi joins us to answer some common questions about these treatments. Dr. Laconi, it's great to see you.
It is great to be here.
I always joke with you and your wife Dana, who's also here in studio, that anytime we're at dinner with friends, somehow it comes up when people are asking about skincare and Botox and all of these things because they know I'm a patient of yours. Today we're going to break down some myths because there's a lot of misunderstanding when it comes to, I think, specifically Botox and fillers, but we got a lot of questions.
Sure.
So let's go for it.
Yes.
Let's actually start with lasers. So true or false, lasers, when we're talking about removing red spots, age spots, brown spots, all of that, lasers have a significant amount of downtime. True or false?
Well, that's purely false. I mean, it depends on the laser. You know, we got a few that do involve some downtime, but I'd say on the whole, most of our laser treatments are maybe a day or two, you know, generally.
Okay. Yeah.
So if that's a lot, then true. But
Not so bad. I mean, I
Yeah.
come to work the following day after
Right.
having a laser treatment.
yeah, there's many of them you can do
I
that.
went to rodeo lineup announcement after doing a
She
laser
did.
treatment.
Yes, the same day.
My
in fact.
God, yeah, no hat because of the forehead, but yeah, but I was there at the front that day of.
There you go. Another true or false, lasers only work on people with very light skin.
Clearly false.
Clearly
Okay.
false.
Yeah. Well, I mean, we have lasers that, you know, can take the full gamut of skin tone and color. So there were some early lasers, which have one or two of them, that won't be acceptable for darker skinned people, but we have now way more than that, just that can be suitable for everyone.
We're seeing video right now of me doing what's known as the trifecta, the Moxie, the BBL, and the Halo treatment. My face was
Terrific little combo.
Yeah, my mom has done this, my sister has done this. I love that they fly to Houston and go to the AntiAge Institute. This is what it looked like when the sun damage was actually just coming to the surface and then eventually flaked off. But Dr. Laconi, was it true that back in the day, lasers were not as advanced? They couldn't work on all skin tones?
No, that's true. We've had a few of those over the years because we've been doing lasers for 25 plus years. So we've had almost every laser that's worth having in our office at one time or another.
They always have the latest there. Okay.
Do another one.
Okay, true or false? It takes a month to see the effects of Botox.
No, false. You know, 2 days you start to see it, and about maybe 10 days you're seeing pretty much the full effect, maybe a day or two beyond that.
Okay, another one. Botox will make my face look plump or overdone. This is a tricky one because I think a lot of people confuse Botox with filler.
Oh, that's a good point. Yes, that is. So it's false. They were probably thinking of fillers, and it's amazing how many people think that they're the same. I mean, you know, we have to stop and explain to people that, you know, Botox is to relax muscles and fillers are to provide volume.
And you guys offer a range of products. I mean, I think people just see a syringe or a needle and they assume that it's one of these things, but this is actually video from a consultation where I was getting, you know, Botox. Anywhere they'll put it, guys. Well, anywhere they'll put it.
And we're seeing Botox along Tessa's masseters, like the muscles that you use to chew, and along her neckline. Are customers surprised that people get Botox in their neck, and why would they do that?
Well, you know, there's two areas you do it in the neck. They have what they call the platysmal bands, which stick out, you know, sometimes when you're talking.
Right where those lines are.
And then there's the little circular lines that go around them. Some people call that tech neck and things like that. but you can do that. You can treat both of those with Botox.
Okay, we got
effectively too. Yeah.
A few more to cruise through. Botox can help prevent wrinkles and fine lines from forming in the first place. True or false? I mean, we hear about prevention. I never believed in the prevention until I started.
No, it's definitely true. I mean, that's why we have 22-year-olds coming for Botox.
Right.
Because they've seen their parents and they go, oh my God, I don't want to look like that.
Oh no. Okay, most filler only lasts a month. True or false?
Fillers last a month? No way. That's probably thinking about the very original filler, which was collagen, but that's 20+ years ago also. So the new fillers, generally speaking, can be anywhere up to 2 years. Yeah.
Oh, wow.
Yeah.
2 years. Well, and this underscores also, you want to go to a licensed injector. You want to go someplace like the AntiAge Institute. You all have been doing this for a long, long time.
Right.
But people are handing out Botox these days on the street corner.
Well,
avoid
I know,
that.
I know. We hear about that kind of stuff. Some of the strip centers, you know, where they open up and they're gone, you know, two months later or something like that. But yeah, all of our injectors are absolutely certified injectors, yes.
Or they'll have like a Botox party. Have you heard of that? And they're using like expired product. I've heard of that.
I've heard of worse, actually, in some of those Botox parties. They're not even Botox parties, they're filler parties, stuff like that. And I mean, there's been some pretty well publicized cases of things that went wrong there. But, you know, if you're going to something that's, you know, where you got certified providers, that's what you
we've all seen the headlines of an unlicensed injector putting who knows what in people's bodies. We're tight on time, so I'm going to jump to the last question. True or false? Semaglutide should only be used under the care of a doctor. Speaking of things that you can get on the street corner these days.
No, that's true. I mean, it's a prescription drug after all. So I mean, you know, you don't want somebody handing out prescription drugs like semaglutide or tirzepatide, any of those, unless there really been, you know, a program that's, you know, provided where you get supervision, monitoring, you know, all the things that you'd expect from any doctor-provided prescription drug.
There you go. It is a prescription drug under the care of a doctor. Dr. Richard Laconi, thank you. But stay right here because coming up after the break, we're going to have more with the team from the AntiAge Institute, including one of the most popular facials, advances in lasers that can remove age spots, and injections, Haley, we're talking about you, that can dramatically improve your appearance.
Okay, guys, don't go anywhere. Houston Life will be right back. Well, welcome back to Houston Life. If you're just joining us, we've been learning more about Botox, about fillers, lasers, and weight loss drugs from our friends at the AntiAge Institute.
Okay, so now it's time to meet some of their patients to learn more about their experience. We've got Haley Parma down there, along with licensed nurse and injector Megan Marco, and licensed esthetician and laser technician Elle McHugh, along with patient Matthew Melanson, and of course, Dr. Richard Laconi joins us once again. Okay, so Elle, you're working on Matthew. You're doing a very popular facial. So you've already done half his face, is that correct?
Yes, so we are doing skin pen microneedling, which we did the left side of his face already, and we're incorporating exosomes with it, the latest and greatest in skincare.
What are exosomes?
So stem cells, growth factors, all the things for stimulating even more collagen in the skin and helping with the healing process.
Okay,
Dr.
very nice.
You know a lot about exosomes. It's a passion of yours. Why is it such a big deal?
Well, it's the latest thing in regenerative medicine. So it was stem cells for years, and then we learned that actually the active agent, the ingredient inside stem cells, are exosomes.
I see.
So you get everything that a stem cell can provide with exosomes, but they're a lot more versatile because unlike a stem cell you have to keep alive, exosomes are just what's inside the stem cell.
And I was actually in the room when the patient on the screen was having this treatment done. There is a little bit of blood involved, but she at one point even said, oh, that kind of tickles a little bit. So the patient is numbed before this procedure takes place. Is that correct?
Absolutely, yeah.
Matthew, what do you...
Very potent.
It's
topical.
You wouldn't want to do it without numbing your face first.
It would sting, yeah.
It would sting. Matthew, what are you feeling right now?
I don't feel anything at all.
And you did the
Just
numbing
a little tingling, yeah.
Okay.
Is it relaxing?
Very relaxing.
What is the buzzing sound we're hearing?
It's the tiny little needles going up and down, going
see.
into the skin to create those micro injuries.
I see.
Well, and I think it's great, Matthew, that you're doing this today because, and Dr. Laconi, maybe you could speak to this. For a long time, were men feeling weird about coming in to do an aesthetic treatment?
Well, you know, I suppose, you know, some do, but it's, you know, looking good and having pretty skin, good-looking skin is is attractive no matter who you are.
Yeah.
You know,
whether you're in the boardroom
men are
or on the
figuring
ball
that
field.
out. They get more attention when they look good.
Yeah,
That's right, man.
Self-care's for everyone. Self-care's for, and anyone feeling weird about it, and your guy, just look at Matthew's skin, please.
I know. It's like, how do you improve upon perfection?
Yeah.
Okay, we want to meet Haley and chat with you. Speaking of perfection, okay, so Haley, I met you a couple weeks ago at the office, and I actually got to witness something that I did not realize was a thing. Dr. Laconi, I've known you for years. Dana, your wife, I've known for years. You're two of my dear friends. I didn't realize people use filler to actually kind of tweak the shape of their face and jawline. This is like a thing.
Well, we've had the tools to do that for a while, but now we've got some new fillers that are really awesome for this. They have the right texture and body. They can actually create sculptural and structural improvements in someone's face. So what we're talking about here is molding the jawline.
Wow.
You know, so a nice, clean, sharp jawline is something everybody loves, right? So if you don't have that, in the past, you could go to a plastic surgeon and they'd put in implants, and when it came out, you're never really sure if it was going to be what you wanted. Well, here, you're part of it. You can have a mirror and watch and say, no, I'll take a little bit more, maybe not, you know, da-da-da. So we can build a jawline that's nice and sharp and clean and everything, as you see there.
These before and afters are unbelievable.
They're incredible.
Well, we got the right tools, and so it's just much more effective, and it's quite durable. It'll last for 2 years.
Wow.
And beautiful before and after, but it looks natural. And I think this is one of the things you say, hey, we don't gatekeep this. This is for everyone. If this is something you want, it can easily be done.
Absolutely, yeah. And you can be a part of it. I think that's still one of the most attractive things, is that, like, if you're sculpted someone's chin in the past, you know, you weren't a part of it. But now we can inject a little bit, and you can look at it with a mirror and say, well, a little more, and you can put a little bit more, and then you stop. You know?
Right.
So you don't get too big a chin, you don't get too little, you get exactly what you want.
The proof is in the pudding. We've been seeing a lot of before and afters, including Haley, yours. Haley, can you tell us how you're feeling today? Because you look great.
Yeah, it was 2 weeks ago, I think, and it was a really easy recovery, and the process took a couple hours, but it was really easy and kind of relaxing, honestly. I didn't feel very much, and just sat there for 3 hours while they did their work, and it was fabulous.
At one point, I think you may have fallen asleep. Again, I was in the room.
I truly think I dozed off.
You dozed off. And Megan, we saw you going to work with CT. When you're doing these facial balancing injections, I mean, it was so fascinating watching you go to work, because you are very detailed. And this just underscores that going to the right injector, if you're going to have filler lasting 2 years, you want it done correctly.
It's definitely an art, for sure.
And you really take your time with it, right?
Absolutely.
I mean, Haley was saying that this took a couple hours. Is that typical for most patients?
Typically, yeah. CT and I both were perfectionists, so you will not leave our chair until we're satisfied. So.
And can you just quickly point out where the areas are that you added filler? We're tight on time.
Yeah, so we did actually her chin and her jawline, just to help kind of create that linear structured jawline and give a little bit of projection and length to the chin to provide that heart-shaped face triangle of youth.
And then you ended with a little bit of Botox.
We did a little bit of
well.
Botox too, yes, just to smooth everything out, just cherry on top.
Okay, and as they're
perfect.
we were also talking about lasers. We were talking about the Moxie, which I've done, the BBL, the Halo treatments. Can you touch on that a little more?
Yeah, well, of course, that's the trifecta you were speaking of earlier that you've had. And some of these new lasers have much less downtime. They can do 2 or 3 different things at once. In other words, they can tone, improve the overall tone of your skin, get rid of red spots, brown spots, all that. Texture, they can improve the structural, the structure of the skin, the pore structure. If it's too thick, you can reduce the pore size. And tighten, they can give a little snugging in the skin. So, and since they're such a low downtime with these, you can just repeat them as often as you want.
It's pretty cool. It's miraculous to just watch your 8 spots fall off. Dr. Laconi, Megan, Elle, along with patients Haley, Matthew, thanks so much for stopping by. Your skin all looks beautiful, by the way.
Glowing.